Here is my audience. Hi everyone, I am Kristen McDonald and I will be doing my final informative speech on at-home wound care. So basically, what is at-home wound care? So at-home wound care is not as easy for the patient or the family member that carries out the task. And if not done correctly, it can cause more harm than good. So it's very important that we follow proper instructions and procedures when doing at-home wound care. So what is wound care? Well, according to Wikipedia, a dressing is a sterile pad or compress applied to a wound to promote healing and protect the wound from further harm. A dressing is designed to be in direct contact with the wound as designated from a bandage, which is most often used to hold a dressing in place, and many modern dressings are self-adhesive. So what is at-home wound care? What's the difference? Because wound care you can get in a hospital, you can get at home as well, you can get it in a nursing home, and if you're military, you get it out in the field if necessary, if you're in a war zone, same thing. So according to wound care centers, applying topical antibiotics to prevent infection, like using a local anesthetic or maybe providing the patient with some pain pills before the procedure is done, can help reduce the pain. And covering the wounds with a dry, clean bandage can be helpful with nearly all types of wounds. The only difference is if a wound care nurse is not doing it, it is a family member that has been shown how to do it by the wound care nurse to go ahead and handle the task at hand. Which does happen and is okay to do, because when you're doing wound care at home with your family, you're surrounded by your own germs and it's your own environment versus being somewhere like a nursing home, even hospital. Even though it's seen to be as a sterile environment, it can still lead to passing on germs because you have a vast amount of people at hospitals and nursing homes that do not share the same germs and bacteria as you would with a family member. So what are the procedures for at-home wound care? Well, according to Medline Plus, you do the removing of the dressing and you follow pretty much some pretty basic steps. You want to wash your hands with soap and water, usually for 20 seconds. From my experience, when I went to the LVN school at Anamark, they would tell us to sing Happy Birthday twice, which was more than efficient enough time washing your hands. After you wash your hands, you want to make sure that you get a pair of non-sterile gloves, and carefully, when you put the gloves on, make sure you're not really touching anything else besides maybe your supplies when you're applying the dressing to the wound or anything that you might be using for the wound. So after you have your gloves on, you want to carefully remove the tape from the wound, from the old dressing. And if you have a hard time removing it, because sometimes the adhesive can get really stuck to the skin, you want to take an alcohol swab and go ahead and dampen the bandages and the tape to help remove the adhesive from the skin, because you don't want to put your patient in any pain. And after you remove the tape, you want to remove the old dressing. And when you remove the old dressing, you just want to make sure that you don't let that stuff kind of fall out, because it is covered in germs, bacteria, infection, depending on how bad the wound is. It could be just like a simple dressing where you're just changing a band-aid or something. But it also depends on the type of wound that you're dealing with. In my case, we are dealing here with a stage 4 pressure ulcer, so it is a pretty deep wound. When you remove the gauze, pads, or packing tape from inside the wound, you want to make sure you place that into a plastic bag and take it away from your somewhat sterile area. It's not completely sterile, again, because this is at-home wound care. So when you're cleaning the wound, you want to follow some steps when you're cleaning the room, now that you've had all the bandages taken off. You want to put on a new set of sterile gloves, because you don't want any of that bacteria from the dressings that you removed on your sterile gloves. When you want to take a clean, soft washcloth to gently clean your wound with warm water, soap, or saline. In our case, we use saline because of the type of wound that it is. It's very open, and it actually shows nerve and tissue. You want to rinse the wound with saline, gently patting it dry with gauze. Do not rub it at all, because then you're going to irritate the new flesh, or depending on what type of wound, you're going to irritate the skin. And you don't want to do that, because it's going to cause more harm to the patient. And you're going to check the wound for increased redness, swelling, or bad odor, and that lets you know if the wound is actually infected and if maybe you might need to contact your doctor and get more assistance in the wound. And if you don't see this, then you want to go ahead and proceed. And you want to pay attention to the color and the amount of drainage from your wound. Look for drainage that has become darker or thicker, and that usually comes from slough, which is your pus and your bacteria that actually comes out of the wound as it's draining. So once you've done this and you've cleaned out your wound, you're going to remove your gloves and you're going to put them in a plastic bag with the old dressing and the gloves, the ones that you did when you removed the dressing, and you're going to wash your hands again because you just touched, again, bacteria infection. So just like before, you want to go ahead and sterilize everything again. When you're changing the dressing, you're going to follow these steps. You're going to put on a new pair of non-sterile gloves. You're going to take medication and apply it to the wound, making sure to cover every part of the wound. In our case, she's got a deep, in our case, my mother-in-law, we used her for an example. She actually has a stage 4 pressure ulcer, so we actually have to pack her wound in with medication and gauze. And then after you put in the medication, you're going to pack it up with gauze, and you're going to make sure you put enough gauze in there to where the medication pad is completely covered. Then you'll place a dry ABD pad over the wound, and then you'll pack it with more medication gauze, which protects that. Using medical tape, you're going to tape around the ABD pad to hold it all in place and hold all the package in place. You're going to put all used supplies in a plastic bag, close it securely. Then you're going to put in a second plastic bag, basically to keep all the germs and infection and bacteria in there, and you're going to secure that bag, and then you'll put it in the trash. After you've done securing the wound and you've bandaged it up and you've gotten rid of all your trash, the final step you want to make sure you do is you want to wash your hands again, because you don't know if maybe something may have gotten on you, may have gotten on some of the bed, or maybe a chuck, which is a lining that they put on the beds to absorb any type of fluids coming from the body. And it's just a precaution because you don't want to get any type of infection. You don't want to get any type of bacteria growing in you. So you want to make sure, again, that you wash your hands thoroughly. So one thing you also want to do when you're doing wound care is you also want to make sure your patient, client, or family member is comfortable. You want to make sure that they're not in any pain, or let them know that it's going to be painful, but you're going to try your best to make it as least painful as possible. So according to NCBI, family members that provide care to family members at home usually help with activities of daily living, also known as ADLs. And usually if a nurse cannot be available every day due to insurance coverage, which does happen, they will show you how to take care of a family member when it comes to wounds and how to change the dressing and how to clean it. Now, if it's something that you really don't feel comfortable with, then of course you would let your care provider know and see if maybe you can get more wound care nurses to come over. Now, how they provide comfort to the family member is actually being the family member themselves. They tend to provide that comfort alone just by being a family member, knowing that they're taking care of you instead of a stranger, because some family members don't really take kindly to other people taking care of them. So that's one of the ways to comfort your patient or family member, is being the person that's a family member helping them. You also want to be able to make sure that they are prescribed the proper medication when you're doing wound care, because you don't want them to feel, you would like for them not to feel any pain, but that's sometimes not possible. So you want to make them feel the least amount of pain as possible. So you usually want to provide them with a pain pill, which is usually prescribed by a doctor when you have a wound care patient. And you usually want to provide it at least 30 minutes before you're going to do the wound care. So after you provide them with the pain pill and it's kicked in, then you can go ahead and proceed with changing of the wound, because now they're not going to feel the pain as much. And it's so early that you've given them that pain pill, after the wound care has been done, the pain pill will kick in fully and take away the remainder of the pain after the dressing has been applied. So what do you do when you're done with wound care? Well, according to WebMD, after wound care is completed, you want to make sure you clean up all the supplies that are used. You don't leave anything left behind, because like I said before, bandages that are left behind carry infection, bacteria, and body fluids, and this can cause germs to being spread to others and cause more infection if left behind. You want to make sure you throw all supplies away in proper containers. Make sure to change all bedding. If the bedding gets soiled with any of the infection, then you want to make sure you change that. If it is possible, like I said, to get chucks, which are little pads that are put on the bedding to keep it from getting dirty and keeps the bed clean, and it soaks up all the drainage. You just want to replace those with new ones. So after you've done this, you want to be able to document everything that you've done, which is usually the final step. So according to wound consultant, document the type of wound and the location. Describe it if possible, and describe it in a way that it gives as much information as possible. So you want the location, you want to describe the wound. If it's a partial fullness or thickness of wound, you want to describe the stage of the wound. If it's a pressure ulcer, in this case with my mother-in-law, she has a pressure ulcer. So these are very important to know because it shows the timeline at the wound starts, when the wound starts to heal. So it gives a good insight to doctors and nurses to basically see whether or not the patient is doing better or if they're doing worse, if they need more assistance, or if they can proceed on with the normal wound care that they've been doing right now, or if they need to be hospitalized. So those are very important things that you need to focus on when doing at-home wound care, because you have to remember this is not a hospital. This is a home. So you're not going to get all the medical supplies that you normally would get in a hospital readily available to you. Because when you're in a hospital, it's easy to call a nurse or a doctor and say, hey, I need such and such supplies. This is at home, so sometimes you have to make do with what you have. But if you don't have what you really, really need, like medication or certain supplies, you really don't want to be doing any type of wound care because you're not really benefiting the patient. So basically, in conclusion, always make sure to follow proper procedures when cleaning a wound. Make sure your patient, client, or family member is comfortable and in the least amount of pain as possible, and always clean up after yourself, making sure no bandages or garbage is left behind. Document everything that was done in case anything happens. You have documentation to look back on, because again, like I said, doing at-home wound care is just as important and is just as difficult as doing it in a hospital. It's not an easy task. There are a lot of things that can go wrong, and there's a lot of things that can happen. So we want to make sure that the patient, family member, or client is always taken care of properly at all times. So this is the end of my speech. I hope you enjoyed it, and let me go ahead and reframe back to my audience. And there's the rest of my audience, and that's the end.